Hey, this is Dr. Amanda from StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about a common question that I see in a lot of Invisalign consumer-facing forums about whether or not they can view their ClinCheck, which is the branded term for the animation of what your teeth will look like as they move. It's generated by the computer. Your doctor contributes to that as well as their technicians and their software. But in any case, there seems to be a misunderstanding or misconception that you cannot view it before you buy. And ultimately, this is not up to Invisalign or Align Technology. This is up to your doctor, how he chooses or she chooses to charge you. Now, I can tell you on their end, there is no fee for them to get the simulation. So they only pay their fee to Align Technology, depending on what complexity of treatment you have once it is approved by them. So they can see it and they can share it with you. And all of this is built into the portal by Align Technology. So Align Technology has built this all so you can see it. Now, whether or not your doctor chooses to share it with you is up to them. So I like to say, if this is a concern to you, and it really should be a concern, every patient should see their ClinCheck before they buy, especially if they have questions or concerns. I wouldn't pay for something sight unseen, for certainly not, because what if it's not good, or what if it's not what you want, or if you don't like it? Because what kind of cracks me up is these patients will get to the end of their treatment and they'll say, I don't like this. And I say, well, did you ever see the ClinCheck? Did you know what you were getting? Maybe what you thought you were getting is not what the doctor thought you were getting. And the only way the two of you can really communicate is to look at the ClinCheck together. So if this doctor doesn't know what he's doing, or perhaps what you thought was possible isn't even possible, it might not even be possible, why would you start treatment? I don't get that. So yes, I have videos. So if your doctor does not know how to do this, it's very easy. I have a video on exactly how they can go about sending it to you. It's not as easy as you think in terms of, because of HIPAA compliance, which is a law, especially in most countries. They have to go through this special process where it's a two-step process where they email it to you and you get a password. It's not hard by any means, but it's something your doctor will have to do on their end. It'll come by email. You can view it then, and you can play with it, manipulate it, everything like that. You can see how many stages it is and all that. So that would be my suggestion, is not to put down any money before you see the ClinCheck, if that's a concern to you. So, and I really don't know any doctors that would not be okay with that. Everyone I know would be fine with that if you ask. So, of course, they would like to get you committed to treatment sooner. And of course, they are using a little time and resources, but if they have an intraoral scanner, it literally takes them 1 minute to scan you. Now, again, if you've seen my videos and my tutorials on how to pick the right dentist or orthodontist for your Invisalign or clear aligner treatment, you should only be picking someone that has a scanner. If they do not have a scanner, that is a sign that they are not very, very skilled in this. They're just new. Because anyone that does a fair amount of cases has a scanner. There's just no way you wouldn't. It just saves so much time and money. It just doesn't make sense. So if your doctor does not have an intraoral scanner, if you are taking a gooey, rubbery impression for your aligner treatment, that's a sign your doctor is not experienced. Now that's okay if that is, as long as you're aware of that. But I think most doctors are less likely to let you see your ClinCheck without putting down some deposit if they're doing impressions, because it costs them money. It's resources. The scanner doesn't cost you anything. Maybe the cost of the tip, which is like $3, but it's pretty much a drop in the bucket, especially if you're a good patient. So hopefully this was helpful. Hopefully it gave you some scripting so that you can approach your doctor before you start your treatment and tell them what you expect and what you'd like to see. And I want you to see your ClinCheck, and I want you to share it, and share it with other people, share it with friends and family, get feedback, show it to other dentists. If this isn't your general dentist, this is your orthodontist, show your general dentist. Say, what do you think about this? Because sometimes when there's an accountability loop, you get a much better outcome. Remember, it is the doctor that sets up the ClinCheck. The technicians just do what they say. So if your doctor doesn't know what they're doing, I'm laughing just because I see it all the time. If your doctor's winging it, not all dentists have training in orthodontics. Many have zero training in orthodontics. They might just take a weekend course. They might take no course. They might just take an online course. It is not generally taught in dental school. It is only taught in residency. which is a 2 to 3 year additional training full time that I've taken and many other orthodontists have taken around the world. Doesn't mean to say that general dentists cannot do orthodontics. They absolutely can, and I have some that I work with that are absolutely fantastic. But it takes time and it takes practice. And I wouldn't want to be anyone's guinea pig, is just what I'm saying. So in any case, hopefully this was helpful. All right, thanks so much.